Welcome back and happy Wednesday. I have missed you. This is Nurse Eunice, and in tonight's video, we are covering medical prefixes and suffixes. Yes, we have a review first and then a quiz. As we do in each of our videos, we're going to give you a few moments to receive your notifications, and we will get started shortly. Everybody, as you're coming in, let me know if we have any issues with the audio because we are live. Hey everybody, happy Wednesday. April Fools. I know you thought I cut my hair. I didn't. All right, so let's get started. How are you all doing? So many of you all have supported us and have purchased our CNA exam prep study guide, and we want to say thank you. We really appreciate you. If you've not yet purchased it, let me tell you, it has easy to read, real world scenarios, step by step clinical skills. It also comes with a practice test and just numerous checklists. So there's no reason for you to fail the CNA exam. If you want to purchase, you can go directly to our website or you can scan the QR code that is on the screen. Hey, Augustine. Hey, Nadij. For those who are interested in using flashcards to study, we also have a surprise for you. So we've partnered with Brainscape and we give you a free trial where you can go on and start studying. You would just scan the QR code that's on the screen, and these flashcards are Nurse Eunice approved. I spend hours creating these flashcards because I want to help you pass your examination and I want to help you however you learn. Some people learn best by reading, some like to play games, such as using the flashcards. Whatever you need, we want to provide that resource to you. And then I don't want to go any further without saying congratulations. So, good evening, Ms. Mathis. Thank you so much for helping me pass my state board. You are so welcome and congratulations. And Leslie says, Hi, Nurse Eunice. For those who need help with your CNA clinical skills, yes, we have all CNA skills video, which is step by step. And you can scan a QR code again. And these are all found on our YouTube channel. It's going to be easy. It has a black, white, and yellow thumbnail. It's going to be easy for you to find so you can study. It doesn't matter where you are in the United States or in the world. If you need help passing your examinations, we want to be your go-to spot. So you can go to fltraining.com or you can just click or scan the QR code that is on the screen. And we're going to get started. So get ready for your practice test, everybody. Let's build your confidence. Before we begin, find a quiet space to focus. Have a notebook or scratch paper ready. I'm really going to encourage you to go get that paper now. You have about 60 seconds. Go get something to write on. Read each question carefully and then trust your instincts. You already have the heart for patient care. All right. And Cher says this is her first time here. Leslie's been studying from Buffalo. And thank you, Fernan. You're the best also. Here we go. Let's see how much we're going to learn tonight. So, question number one. The prefix Brady means, is it A, fast, B, absence of movement, C, slow, or D, weak? What does Brady mean? And whether you're a future nurse, a future CNA, a future doctor, or any type of healthcare provider, you have to know what the terminology means. You have to know what a prefix is. A prefix is a portion of a word that comes before a main term and it changes that meaning. A suffix comes on the end. So pre is before, suffix will be on the end. And so whenever you see the word Brady in front of a medical term, oh, we have A's, we have C's, we're a little bit torn. Let's see if we have a few more comments coming through. All right, revealing the answer in 3, 2, and 1. So whenever you see the prefix Brady, if you chose C, slow, you're absolutely correct. Yes. So whenever you think of Brady, I want you to think of a turtle. And so the Brady Bunch, a whole bunch of people inside of a old school vehicle, they couldn't move too fast. So Brady means slow. And when we refer to bradycardia, Brady is slow, cardia referring to the heart. That means that your patient, your client has a slow heart rate. Bradycardia. Let's go to the next one, team. The prefix tacky means, is it A, fast, B, slow, C, irregular, or D, abnormal? What does tacky mean? All right, we'll give you a few moments to enter those answers in the chat. And for this one, we have a lot of C's. We also have an A. And now we have more A's. So tacky doesn't necessarily mean irregular. Someone can have a fast heartbeat, but it would be regular. That would be sinus tachycardia. So the term tacky refers to A, fast. Great job. Tacky refers to something that is rapid, as in tachypnea. Everyone say it with me, tachypnea, which is rapid breathing, or tachycardia, which is a rapid heart rate. Question 3. The prefix hyper means, is it A, below or deficient, B, above or excessive, C, normal, or D, small? What does the prefix hyper represent? I'm going to give you a couple of more seconds to enter your answers in the chat. All right, Leonie says hi. All right, and then we have Messi and Augustine that says B. Everyone's saying B, and guess what? Everyone is correct. Hyper means above normal or excessive, as seen in hypertension, which is high blood pressure, or hyperglycemia, meaning high blood sugar. The prefix hypo means, is it A, above or excessive, B, below or deficient, C, equal, or D, large? Oh, you all are fast with these. They get harder. We're going all the way to question number 75. And that's right, team. For everybody who chose B, yes, hypo means below or deficient, as in hypotension, that's when your patient's blood pressure is lower than normal, or hypoglycemia, when their blood sugar is low. Question 5. The prefix poly means, is it A, few, B, scant, C, before, or D, many? What does poly refer to? All right, we're going to wait for a few more answers. That's right. You all are phenomenal. Poly means many. Yes, the answer is D. So when we say that a patient has polyuria, they're supposed to produce maybe 15 to 30 cc's of urine per hour. That means that this person is urinating excessively, and that is a sign of uncontrolled diabetes. Also, polyneuropathy. Say that with me, polyneuropathy. That means that they have a disease affecting many nerves. So they could be in a lot of pain, or they could have a lot of tingling and numb sensations. Let's go to number 6. The term oligo means, is it A, many, B, normal, C, few or scanty, or D, abnormal? And these are terms that you're going to see when you're taking care of patients, when you're reading their charts, when you're reading their histories and physicals. This is why we want you to know these terms. It's going to make you a more knowledgeable caregiver. So this is not just about you passing a test. It's about the end result is keeping a patient safe. So whenever we say oligo, that is referring to C, few, or scanty. as in oliguria. So first we talked about polyuria, which is when they had a lot of urine, but when someone has oliguria, they have low urine output. Maybe they're dehydrated, or maybe possibly they could be having kidney failure. This one should be an easy one for you. The prefix a or an refers to, is it A, with or without, without or not, B, excessive, C, against, or D, slow? If you see A or an in front of a medical term, what does that mean? Right, we see an A, I see a C, see it, more C's. I think the A's have it. And so, if for question number 7 you chose A, you are absolutely correct. So, when you see A in front of a word, that means there is a lack of, there is an absence of that. So, A or an means absence or lack of something, as in apnea. So, when a patient is apneic, they're not breathing. Or if someone is anemic, they have a lack of red blood cells. Question 8. The prefix anti means, is it A, before, B, against, C, inside, or D, between? And for our channel members, I've already dropped this exam in our community area. So you check the community post for Florida Training Academy and you're going to see your test. It's already there. So you can have a competitive advantage, get every answer right. Plus, you can study with your classmates and with your friends. So, anti, whenever you see that in front of a medical term, it's against, such as antibiotic, it is against bacteria, or anticoagulant, that would be preventing blood from clotting. Question 9. The prefix pre means, is it A, outside, B, inside, C, after, or D, before? Let's see our answers. Looks like Leslie has C. I'm not sure if it's for this one or another one. Yannicka has A. Leonie has D. Cher has D. Messi has D. We'll wait for 2 more responses. Augustine has C. All right, revealing the correct response in 3, 2, and when we put pre in front of a medical term, that means C before. Excuse me, was that? I had that wrong. It means D before, excuse me. So D is the right answer. Pre means before, as in prenatal care or the care that a mother would receive before birth. The prefix post means A, before, B, against, C, inside, or D, after. You learn these medical terms, again, they're going to help you understand what the nurses and the doctors are saying. It's going to help you when you read a patient's chart, when you read their history and physical, because your patient could be D, they could be post-operative. And so, usually after surgery, they're going to be immobile or in the bed for a little bit because the anesthesia that's still in their system could make them a fall risk. So, you understanding what some of these prefixes mean is going to be and suffixes will be very important. So, post means after, as in post-operative care, and that's care that will be performed after surgery. This one's a hard one. The prefix endo means, is it A, outside, B, through, C, inside, or D, below? I'm giving you a few more seconds to input your answers in the chat. Great job. Endo is going to be C. It's inside. Endo refers to something internal, as in endoscopy, looking inside the body. So many correct responses. I'm proud of you all. The prefix XO means, is it A, inside, B, outside, C, below, or D, above? Hey, looking for some correct responses. I see C's, I see a D. I'll give you a few more seconds. Looks like Fernand, Lindry World, and Raquel. Looks like you have it. Yes. When we refer to exo, it's outside, such as exoskeleton. So exo means external or outward. And so when you think of an exoskeleton, you usually think about insects. However, there are some I can't even think of the word, prosthetics, which can be used and placed outside of a person's body in order to help them stand up. So a prosthesis. So that would be an exoskeleton that you may see in a medical facility. 13, the prefix intra means, is it A, between, B, inside, C, across, or D, after? Intra. Hey, Amike. What does the prefix intra mean? All right, Anna K says B, Messi says A, Richard says A, Augustine says A, and so looks like some of you all will be learning a new prefix today, because intra means inside, such as intravenous, inside of a vein. So the answer is going to be B. So intra means within, as in intravenous. I think this is where you got confused. The prefix inter means, is it A, between, B, within, C, across, or D, under? Think anatomy and physiology. Think of all those courses you took, those science courses. So if intra was inside, inter would be, I know medical prefixes are hard, which is why I want you to have paper and pen. Write these things down so that you can remember them, especially if you got them wrong. All right, we have A's, we have D's, have a lot of A's. And the A's have it. Woof, woof, woof. Let me give you my goofy nurse dance. Yeah. And so it means between, as in intercostal. So whenever your nurses, your doctors are listening to the apex of the heart, it's located at the fifth intercostal space, or the fifth space between the ribs. And so when you think of inter, think of between. Great job, team. The prefix peri means, is it A, inside, B, under, C, around, or D, through? Yes, Anna Kay. I don't know. Sometimes on different platforms it's streaming, so it goes a little bit slower because we're not streaming on YouTube. We're streaming to YouTube and also to TikTok. So sometimes your answers may be delayed. All right. And so for Perry, we have a lot of C's. Let's see if you all are accurate. And you are. So, whenever we talk about peri, it refers to something surrounding an area, such as the pericardium, which will be the membrane around the heart, or when we say that you have to perform pericare, okay, or peristomal care, excuse me, when you look at this illustration or this image, this person has a stoma. And so you'll be cleaning around the stoma. That will be peristomal care. Good job, Leonie. The prefix sub means, is it A, excessive, B, above, C, near, or D, below or under? Thank you so much. Oh, that was so sweet of you. I appreciate you so much. Thank you. I rarely get super chats, so thank you. That was so sweet of you. Oh, I can't wait to hear when you pass your exam. All right, so everybody, question number 16. The prefix sub means D, that's right. Below or under. Sub means beneath, as in subcutaneous, under the skin. The prefix trans means, is it A, across, B, within, C, below, or D, before? And Ferdinand, I cannot insert hearts on this platform, but if I could, you get a huge one right now. So if you all need help studying, Ferdinand, he's passed his examinations and you can too. And he's back to learn more. So that is freaking awesome. All right. So for this one, everybody, it is A, across. And you'll see this like whenever we're teaching you how to use an AED and we have those pads are sending energy through the skin. So that would be like transcutaneous. But if your patient has a medication patch on, that patch is sending medication across or through the dermis, the skin. So that would be a transdermal patch. So if you see a medication patch and you touch it without gloves, that means that that patient's medication can also be absorbed through your skin. So transdermal is going across the skin, and that's how it's going to be absorbed into the body. The prefix dys, does it mean A, normal, B, excessive, C, difficult or abnormal, or D, slow? And we're going all the way to 75. So thank you all for studying with us tonight. And I have missed you all. Right, so we have A's, we have C's, so like we have a B. So whenever someone, if they have a medical condition that starts with DYS, that means C, they're having difficulty. So it could be dysuria. And a lot of your patients who have dysuria, that's usually a sign of a urinary tract infection. So dys means disordered excuse me, or painful, as in dysuria. The prefix hemi means, is it A, half, B, double, C, many, or D, whole? All right, revealing the correct response in three, two, and You have it. Hemi is half, as in hemiplegia. What would happen to a person's body after a stroke? That would be paralysis on one side. I always get this one wrong. The prefix macro, macro, means, is it A, below, B, small, C, large, or D, normal? I know Anna Kay, but when you come on, I still remember your names. You all, you've been with us for a while, so we appreciate you for watching. So macro with an A, not micro. What does macro mean? You got it. You got it. You got it. In this case, you're smarter than a nurse because I always get this one wrong. But yes, it is C. Macro is large, as in macrocephaly. Say it with me, macrocephaly, or when a newborn or an infant has a large head. The prefix micro means, is it A, small, B, normal, C, large, or D, excessive? So macro had an A, micro has an I. Ooh, I'm tricking a few of you all. I see C's, I see D's, I see B's, I see A's. We went all around the alphabet. So macro is large. Micro, think of something you have to use a microscope for. That's right, Leonie. It's small, so it is A. So micro refers to small as in microorganism or a tiny living thing. The prefix neo, does it mean A, large, B, old, C, fast, or D, new? And if you've stayed this long and you haven't given us a thumbs up or shared our video, please share. We need to help more healthcare professionals learn their terminology so they will be successful on their examinations. It's hard to pass a test if you don't understand the terms that they're using on the test. All right, revealing the answer in three, two, and neo refers to D. That's right, Messi. It is neo, as in new, as in neonatal or a newborn. The prefix pan means, is it A, few, B, all, C, half, or D, none? And remember these terms because in a few more questions, we're going to go straight to our practice test. So this is just a quick review of the prefixes and suffixes before we start using them in medical terms. All right, so we have a lot of D's. We have an A. Make sure I didn't miss anything. Looks like we have one correct response so far. So I give you a few more moments. Three, two, and I is not A or D. Pan is all, such as a pandemic, something we just went through. So the answer is going to be B. I think Fernand had it. So pan means all, as in pandemic. And looks like Emilia has it also. The prefix contra means, is it A, against, B, before, C, between, or D, with? Think of a word that starts with contra. What does contra mean? Giving you a few more moments. So think of contraindicate. When you tell someone, stop contraindicating me, that means they're going against what you're saying, right? So contra is A, it is against. So contra means against, as in contraceptive. That is something that prevents pregnancy, it goes against conception. The prefix auto means, is it A, self, B, other, C, across, or D, before? If someone has an autoimmune disorder, what does that prefix auto refer to? I see D's, I see C's. Joyce has it. Joyce has A. So that's right. It is self. So an autoimmune disorder is the body fighting against itself. And so the answer is A. Let me wave back at you, Joyce. Hold on. Hey, Joyce. The suffix itis means, is it A, tumor, B, inflammation, C, pain, or D, enlargement? And I know there's a bit of a delay. All right, revealing the correct response in three, two, and yes, for everybody who's putting B in the chat, you have it. The suffix itis means inflammation, as in arthritis, which refers to inflammation of the joints, or bronchitis, which is inflammation of the bronchial tubes. The suffix oma, does it mean A, disease, B, inflammation, C, tumor or mass, or D, paralysis? This one's a little bit tricky. Oma, as in carcinoma. So this one is a suffix. It's coming at the end of a word to change the meaning. But when someone has a carcinoma, that's right, everybody. It's C, a tumor or a mass. So oma refers to a tumor or mass, as in carcinoma, which is a cancerous tumor, or lipoma, which is a fatty tumor. The suffix algia, what does it mean? Is it A, swelling, B, pain, C, infection, or D, rupture? You're welcome. I love studying with you all because I know you're going to go off and do great things. And Missy, I see you. And Joyce, yes. So algia means pain. So it's B, as in neuralgia, which is nerve pain, or myalgia, which is muscle pain. The suffix megaly means, is it A, small, B, infection, C, softening, or D, large or enlargement? Think of the word megaly. It literally has mega inside of the suffix. So when something is mega, is it small? No. So I give you a few more moments. That's right. Whenever you see the suffix megally, you automatically know that whatever it's referring to is enlarged, as in cardiomegaly, which would be an enlarged heart, or hepatomegaly, which is an enlarged liver. So the answer is B. Looks like we're on question 30. All right, so we're going all the way to 75. The suffix emia, what does it mean? Is it A, a blood condition, B, disease, C, study of, or D, instrument for viewing? When you see EMIA at the end of a word, that would be a suffix. What does that suffix mean? All right, give you a few more moments. And again, for our channel members, this practice test has already been uploaded to the members only post. So you would check the post from Florida Training Academy and you should be able to download your April slides. And we're going to get you 4 slides each month. So you'll get a new practice test each week. So thank you for being channel members. And for everybody who chose A, that's right. Think of sickle cell anemia. So when you see EMIA at the end of the word, that's something referring to a blood condition. Also think of hyperglycemia. That is when the blood sugar would be high. And the way they measure that is, of course, by getting a drop of blood. You'd be doing a finger stick. The suffix logy, L-O-G-Y, what does it mean? Is it A, the study of, B, treatment, C, disease, or D, instrument? And I pray that everyone's having a wonderful day. If you have a test coming up soon, my thoughts and prayers are with you. I know you're going to do well because you're studying and you're taking this seriously and you care more about patient safety and patient care than you do about just simply passing the test. Passing the test is just one part of it. After you pass this test, you're going to be taking care of people who have diseases, and you're going to be working with people who study things such as a cardiologist or a neurologist. And so whenever you see LOG or logi, it's referring to A, the study of. And so when we say that someone is a nephrologist, that is somebody who studied the kidneys. Okay. A cardiologist has studied the heart, and a neurologist has studied the nervous system. The suffix pathy means, would it be A, treatment, B, enlargement, C, condition, or D, disease? And this one's tricky. So we know it's not B because we said megaly was enlargement. So would it be A, C, or D, process of elimination? Looks like Elitha says A, Vivian says A. All right. Joyce says D. Leonie says D. Oh, we're torn between the A's and the D's. Let's see who wins. Revealing in 3, 2, and it's a lot of A's. All right, and so the answer is D. So write that down. So pathy was not treatment. Pathy is D, disease. So pathy refers to a disease or a disorder such as neuropathy, which would be a nerve disease, or cardiomyopathy, which is a disease of the heart muscles. The suffix ectomy means, is it A, incision, B, surgical removal, C, repair, or D, treatment? And I love studying with you all. I'm going to give you a few more moments to put those answers in the chat. All right, so ectomy means that's right. You have it. It is B, the surgical removal, such as appendectomy. When someone has an appendectomy, that usually means that they have appendicitis or that their appendix is infected and inflamed. And so they're going to remove the appendix via an appendectomy or tonsillectomy. So if you look here on the image for me is going to be on the left. The tonsils are swollen and they looked infected. You see those white purulent areas. And so if they can't get those tonsils to decrease with antibiotics in time, that can actually block someone's airway. So they would have to remove the tonsils, and that is referred to as a tonsillectomy. The suffix scopy, what does it mean? Is it A, viewing with an instrument, B, treatment, C, incision, or D, removal? Scopy. Revealing the correct response in 3, 2, and it's going to be A, viewing with an instrument. And let me go back. All right, so Kimura, I take my test next week in Iowa. I've been watching your videos. I'm ready and nervous, but ready for more. And so you're going to do fine. Thank you for watching. Thank you for actually taking the time to study. And hopefully next week when it comes, your anxiety will be less. It's okay to be nervous. If you make a mistake during your test, just make your nurse be made aware. And I'm not sure if your state lets you do the written test first and the clinical test second, but regardless, whether you're taking both tests on the same day as we do in Florida, or if you're taking them on separate days, give yourself grace. It's okay to make a mistake. You just don't put water in someone's mouth while they're laying down. And if you're putting someone in a wheelchair, make sure you, of course, lock the brakes and don't forget to wash your hands. So if you don't make a major safety violation, you're going to pass your test on your first attempt. And we have another question here. Looks like Cheetah says, can we study for the phlebotomy NHA certification? Cheetah, I have a whole playlist on phlebotomy. And so I don't think I'm going to be able to get to phlebotomy this week. But if you just check our playlist on our YouTube channel, you're going to see about 10 videos for the phlebotomy certification. And a lot of people have said that they've used our materials and passed their examination. So we wish you much success also. All right, let's go to our next question, team. All right, so stomy. What does stomy refer to? Is it A, cutting in two, B, surgical opening, C, removal, or D, repair? So what is a word that ends in S-T-O-M-Y? Is it colostomy? Is it tracheostomy? So when someone has a stomy, what do you think? Is it A, B, C, or D? All right, I'm seeing a D, and you're welcome, dear. I see an A, and Cheetah says opening. So yes, we are opening. So the answer is going to be B. Great job, Nadij and Leonie. I see a lot of answers coming through. So stomy refers to creating an opening, as in colostomy, okay, or tracheostomy. The suffix plasty, what does it mean? Is it A, repair or reconstruction, B, disease, C, tumor, or D, softening? When someone has rhinoplasty, what surgery did they have? Rhinoplasty. Well, looks like we just got some more good news. Vivian, I'm so proud of you. I just passed my exam, NHA patient care. I'm so proud of you, Vivian. Congratulations. Everybody, plasty refers to, that's right, a surgical repair. Look, usually it's going to be reconstructive surgery. So it is A. Plasty refers to a surgical repair, as in rhinoplasty or nose reshaping, or angioplasty when someone has heart disease and there's a blockage within a vessel. The doctors can go in and clean out that vessel, aka they're repairing the blood vessel, and that will be angioplasty. The suffix synthesis, excuse me, I hope I synthesis, excuse me. Synthesis means, is it A, viewing, B, surgical removal, C, puncture to remove fluid, or D, condition? Synthesis. If you chose C, you're absolutely correct. Synthesis means withdrawing fluid, as in amniocentesis, which is the removal of the amniotic fluid. They need to test it to make sure that baby and mom are okay. The suffix lysis means which of the following? Is it A, pain, B, study of, C, enlargement, or D, destruction or breakdown? And once you start drawing blood, you're going to understand what lysis means. All right, so lysis is something that you don't want to happen because that means you're going to have to go back and redraw that blood again. So, lysis is what happens when you allow the blood to break down. Maybe you shook it too vigorously, or maybe you didn't agitate the blood collection tube at all and mix it with the preservatives that are inside of the tube. And so lysis refers to the breakdown or destruction, as in hemolysis. And if you see, or excuse me, if the lab sees a blood specimen like this, more than likely they're going to reject it, and you have to go back and draw that patient's blood again. So now the patient's unhappy, and of course, you're going to be unhappy with yourself because that's extra labor. The suffix "ria" with two R's, what does it mean? Is it A, flow or discharge, B, rupture, C, hardening, or D, infection? All right, so looks like we have a couple of answers coming through. Messy. All right, looks like we lost connection. Let me add my slides back. Sorry about that, everybody. Give me one moment to add my slides back. I promise I cannot get through one live stream without something happening. All right, so let me know if you're still there. Are you still there? Hello. Hello, YouTube world and TikTok world. All right, let me try to get back to the slide that we were on. Hey, did I lose you all? Are you still there? Okay, perfect, perfect. I had to reset, so thank you all. One day we're going to get through one live stream without things just going wrong. I don't know when it's going to happen because it's like every time I go live. Oh, you're so welcome, Joyce. I just hate that the Wi-Fi doesn't and I have it hardwired and things just still go wrong. So let's go back to our question. Perfect, Kamora. Thank you. Thank you. All right. So this is where we were. And so we're talking about RIA. And so RIA refers to A. It is the flow or discharge, as in diarrhea or frequent loose stools. Thank you, Joyce. Thank you. Thank you. Thank you. All right. So what does I can't pronounce this one, so I'm just going to say rich. So what does RRHAGE? What does it mean? Does it mean excessive clotting, which is A, B, excessive bleeding, C, the study of, or D, treatment? Thank you, Elitha. You remembered. This is what teamwork is all about. You all help me get back on track. So, yes, you have it. It is going to be B, excessive bleeding. And I know you thought you're going to see like a wound bleeding, but people could also have a subconjunctival hemorrhage when they have the bloodshot eyes. So, ridge refers to severe bleeding as in hemorrhage. The suffix graphy, what does it mean? Is it the process of recording, which is A, B, incision, C, softening, or D, surgical opening? Motivating vision. I try to go live once a week, but then life keeps happening. But we're going to try to do lives more often. So hopefully you have your notifications on and we can, you'll be notified whenever we do go live. So thank you for joining us. So many correct responses. There we go. We have a lot of A's. So the A's have it. It is the process of recording. Graphy means the process of recording, as in angiography. And then let's see here. And we're praying for you also, pretty things. I finally made it to one of your lives. I take my CNA written exam next Wednesday, and you're going to do fantastic. All right, let's go to our next question. The suffix Malaysia, what does it mean? Is it A, hardening, B, softening, C, paralysis, or D, rupture? This is a term that you're sometimes going to see if a patient is at risk of falls or if they have degenerative joint disease. I'm giving you hints. So it's common in women, elderly women. So the suffix Malaysia, what does it mean? We have a lot of A's for hardening. We have a B. Cheetah says B. All right, I'm going to reveal the answer so you all write this one down so that when you see it in a medical record, you know what that suffix means. Malaysia refers to softening, as in osteomalacia, which is the softening of bones. And so if you see somebody with that on their H&P or as a diagnosis, that means that their bones are soft, aka their bones are weak. So they're going to be likely to fall. And if they do fall, they're more prone to fractures. The suffix sclerosis, does it mean A, inflammation, B, softening, C, hardening, or D, discharge? The suffix sclerosis. All right. We have a lot of C's revealing the correct response in 3, 2, And the C's have it. It is hardening. Sclerosis means abnormal hardening, as in arteriosclerosis or the hardening of the arteries, which means that person's more likely to have blood clots or maybe a stroke, because once those arteries are starting to clog, it slows down blood flow, which means it gives blood time to clog up, and it can actually travel. Everyone say this word with me, or the suffix with me. Ptosis. Let's say it together. Ptosis. So the suffix ptosis means, is it A, inflammation, B, drooping or falling, C, enlargement, or D, hardening? Process of elimination. You all know this answer, because inflammation was itis, enlargement was megaly, hardening was sclerosis. So that means that ptosis must be, that's right, Joyce, it is B. And so ptosis refers to the drooping, falling, or prolapse of an organ or body part. An example is I have a hard time pronouncing this one, blepharoptosis. All right, don't judge me. I see a lot of words right. That's not one of them, which means the drooping of an eyelid. The suffix tripsy means, is it A, a blood condition, B, surgical repair, C, the study of, or D, crushing? Cheetah, don't be laughing at me. Laugh with me. All right, so what does tripsy mean? All right, we're seeing B's. I see D's. Wait for about 3 more responses. And the D's have it. Yes. So when we say tripsy, we're referring to decrushing, as in lithotripsy. That's the breaking of kidney stones. They can use sonic wave sonar to try to crush those stones so that someone can easily pass them and they won't be in so much pain. The suffix phobia, what does it mean? Is it A, disease, B, weakness, B, pain, C, weakness, or D, fear? If someone has a phobia, if your patient has a phobia, yes, you're right. That means that they have a fear. So it's going to be D. Phobia refers to an intense fear, such as claustrophobia, fear of confined spaces. And I know for a lot of you right now, your role may not be that of a nurse. It could be a CNA, maybe you're a PCA. But whenever, if you are a nurse, whenever your patient tells you that they are claustrophobic, or if they have an MRI that's going to be scheduled, that's one of the questions that you need to ask, because whenever they're in an MRI, it kind of feels like they're in a casket. So imagine being sick, having respiratory issues, or maybe you had a stroke and now someone's putting you in something that is casket like. So if they tell you that they're claustrophobic, you're going to either ask for some type of anti-anxiety medication. You're going to let the doctor know, or we're going to see if we can put them in an open MRI. So keep that in mind. Don't allow your patients who have a fear of being in confined spaces to go into the MRI machine without you taking that extra step to make sure that they're comfortable. Let's go to our next one. True or false? The prefix cryo refers to cold. And you won't have too many true or false questions on a CNA examination or a nursing exam. But true or false, does the prefix cryo refer to cold? Yep, and you all have it. The answer is true. Exactly. So the prefix cryo is related to cold or freezing. For example, cryotherapy is a treatment that uses extreme cold to destroy abnormal tissue. The suffix urea, that what does it mean? Is it A, a blood condition, B, a urine condition, C, lack of, or D, discharge? And we're going all the way to 75. Yes, so urea would be B. That's a condition involving the urine, such as polyuria, which would be excessive urine, or hematuria, which will be blood in the urine. True, true or false? The prefix zero, does it means wet or moist? And I probably said that wrong, but it's almost 10 o'clock here and I'm tired. I know you all will correct me. You're going to let me know. All right, so does it mean true? Does it mean wet or moist? All right, and so for this one, as in xeroderma, it's going to be false. It means dry. Okay, so if someone has xeroderma, they have dry skin. The suffix genic, what does it mean? Is it A, producing or causing, B, disease, C, growth, or D, softening? Reveal an answer in three, two, and we have lots of B's. So let's see if B would be the correct response. And we have an A. So it is A, producing or causing. So genic means producing, as in carcinogenic, which will be cancer causing. Some of the foods that we eat, some of the clothes that we wear, they say that they are carcinogenic. So now we're to our quiz. I hope you're ready. We've reviewed a lot of prefixes and suffixes. So if you have your pens and papers ready, let's get started now. Which of the following terms means inflammation of the liver? Would it be A, hepatomegaly, B, hepatitis, C, hepatoma, or D, hepatectomy? Oh, that was a lot to say. Hepatectomy. That's what I get for making words up. All right, so which one would it be if they have an inflammation of the liver? That is right. Inflammation of the liver would be B, hepatitis. So the suffix itis means inflammation, and hepat refers to the liver, making hepatitis the correct choice. What does the term neuropathy mean? Is it A, nerve pain, B, nerve removal? It will not let me be great tonight. So let me go ahead and add that right back on here. Media. All right, so we were on slide 52, which would be 104. Okay, there we go. We're going to get through this live stream, you all. I don't care if it keeps kicking us off. We're just going to stay here and we're going to finish this. So, neuropathy means, let's see, we have a lot of A's. The A's have it. So, neuropathy means, It's D. So I do apologize. It is nerve disease. So the suffix pathy means disease and neuro refers to nerves. So neuropathy means nerve disease. A patient with cardiomegaly has which of the following? Is it A, normal sized heart, B, a weak heart, C, a heart infection, or D, an enlarged heart? Cardiomegaly. This one should be easy for you all. Revealing the answer in three, two, and yes. A patient who has cardiomegaly has D, an enlarged heart. The suffix megaly means enlargement, and cardio refers to the heart. Again, meaning that cardiomegaly is an enlarged heart. That means that patient is going to get winded fast. They're going to be short of breath, and they may also have a lot of pedal or lower extremity edema because the heart's just too big and this fluid and blood is just sitting there. It's not circulating properly. Which of the following terms means low blood sugar? Is it A, hypodiabetes, B, hyperglycemia, C, hypoglycemia, or D, anemia? All right, so I'm seeing D's and I see B's. I'm going to give you a few more moments. I see an A. So low blood sugar for everybody who is putting C's in the chat, you have it. That would be hypoglycemia. Hypodiabetes is not a term, that's something I made up. So the prefix hypo refers to low or below normal, and anemia refers to a blood condition. So hypoglycemia refers to low blood sugar. What does the term osteomalacia mean? Is it A, hardening of the bone, B, bone infection, C, softening of the bone, or D, bone fracture? Yes, you have it. That would be softening of the bone. It is C. Again, the suffix Malaysia means softening, and osteo refers to bone, making osteomalacia the correct term. A patient with hematuria has which of the following? Is it A, air in the urine, B, blood in the urine, C, low oxygen levels, or D, high sugar levels? If you chose B, give yourself a round of applause. So, hematuria refers to blood in the urine. Which term means the surgical removal of the stomach? Would that be A, gastrectomy, B, gastritis, C, gastroplasty, or D, gastroscopy? Yes, it's going to be A, gastrectomy. Give yourself applause. You all are doing so well. So the suffix ectomy refers to the surgical removal, and gastro refers to the stomach. The term dysphagia refers to which of the following? Is it A, difficulty speaking, B, difficulty breathing, C, difficulty swallowing, or D, painful digestion? right, giving you a few moments. Yes, so whenever a patient has dysphagia, they have difficulty swallowing, so the answer is C. A patient with bradycardia has which of the following? Is it A, slow heart rate, B, fast heart rate, C, weak heart rate, or D, irregular heart rate? Everybody, yes, give yourself applause. It is A. I know it's tricky. Some of you all chose C. Weak heart rate, the heart rate, we would feel a pulse. And so a pulse could be weak, but the heart rate wouldn't be weak. And while D may seem like the correct response, the term that we use for an irregular heart rhythm would be arrhythmia. And so Brady means slow, and cardia refers to the heart. So A is the best term for this particular word that we were looking at. What does the term tachypnea mean? Is it A, slow breathing, B, no breathing, C, shallow breathing, or D, rapid breathing? For tachypnea, if you chose D, rapid breathing, you are right. So the prefix tachy means fast, and when you see PNEA, that refers to breathing, making tachypnea the correct term. The term polyuria refers to, is it A, excessive urination, B, no urination, C, painful urination, or D, bloody urination? The prefix polyuria. I'm going to give you about 5 more seconds. Right, here we go. In 3, 2, and yes, it is A, excessive urination. So the prefix poly means many or excessive, and urea refers to the urine, making polyuria the correct term. The term intercostal, what does it mean? Is it A, inside the rib, B, below the rib, C, between the ribs, or D, around the rib? Sherry, Eve, yes, it is C. Intercostal is C, between the ribs. What does neonatal refer to? Is it A, before birth, B, a newborn, C, an elderly patient, or D, a premature baby? Neonatal. Do you remember what neo stood for? We have A's, we have B's, we have a C, we have a lot of C's and a lot of A's. So neo is not before, that would be pre. So neo would be B, it's a newborn. So the prefix neo means new and natal refers to birth. So prenatal would be before birth, but neonatal refers to a new baby. The suffix tomi, does it mean removal, incision, or cutting into, crushing, or hardening? This one's a little tricky, but looks like everybody got it. And the nurse goes, wow. So, yes, the suffix tomy refers to an incision or cutting into a structure, such as tracheotomy. So, the answer is going to be B. The term contraceptive refers to something that A, increases conception, B, prevents perception, C, prevents pregnancy, or D, causes diseases. And you all, thank you for studying with me, especially if you're on the East Coast or in a whole nother country, because I know how hard it is to just, stay dedicated, stay motivated in the evening hours, but you all are doing it and you're studying with us, and we appreciate you all. So, contraceptive, yes, it's going to be something that C, prevents pregnancy. Oh, let's see if you remember what the prefix pan stands for. What does the term pancytopenia mean? Is it A, increased red blood cells, B, decreased white cells, C, deficiency of all blood cells, or D, excessive clotting? Remember, you knowing what your prefixes and your suffixes mean will help you to answer a lot of these questions and to help you understand the medical conditions. So when we talked about pan, it was referring to pandemic, and pan referred to all. That's your hint. So what's your answer? Yes, it is C. So pancytopenia is a deficiency of all blood cells. Which of the following terms refers to the surgical reconstruction of a joint? Is it A, arthrodesis, B, arthroplasty, C, arthrectomy, or D, arthroscopy? Surgical reconstruction. What was that suffix? Looks like mimoseculaire and a K. Yes, Joyce. So, kind of like rhinoplasty. If we're reconstructing something, that would be arthroplasty. So it's going to be B. Arthro refers to the joints, and arthroplasty, or the suffix plasty, refers to surgical repair. What does the term dysmenorrhea refer to? So this has a prefix and a suffix. It has dys and then it has the rhea. So dysmenorrhea, what does it refer to? Is it A, the absence of menstruation, B, irregular menstruation, C, heavy menstrual bleeding, or D, painful menstruation? So rhea was flow or discharge, and dys in front of a word means what? I think I only see one correct answer so far. So everybody is not C. Dys doesn't mean heavy. Think dysuria when someone has a UTI. So dys wasn't heavy. That's right, Emilia and Leonie, and I saw Joyce earlier and a few others. So this is painful. So dys refers to pain, and then menstruation is the flow of blood. So the answer is going to be D. Great job, everybody. A patient with hepatosplenomegaly, what do they have? Is it A, inflammation of the pancreas, B, infection of the liver and spleen, C, enlargement of the liver and spleen, or D, abnormal hardening of the kidneys? I probably need to do a video on the longest medical word. Hepatosplenomegaly is a close runner up. So yes, if someone has hepatosplenomegaly, they have C, an enlargement of the liver and the spleen. And we only have a few more left, team. What does the term osteonecrosis? I didn't talk to you about necrosis. What does osteonecrosis mean? Is it A, softening of the bone, B, tumor of the bone, C, death of the bone, or D, infection of the bone? So we know softening was malacia, tumor was oma, infection or inflammation could be itis. So process of elimination, what is osteonecrosis? Yes, everybody. So if someone has an amputated extremity, amputated toes, normally it's because that part of the bone became necrotic. It was no longer viable. And so the suffix necrosis means death of tissue. Osteo refers to bone. And whenever the bone dies, we're trying to save it. We're giving the patient antibiotics. But if that bone dies so that their whole body doesn't become septic, that is when the surgeon, the doctor, will decide to go ahead and amputate that part of the body. Which of the following terms describes the process of measuring lung function? Is it A, spirometry, B, pleurocentesis, C, bronchoscopy, or D, pneumonectomy? I know so many people are choosing C, but C says scopy. And whenever you see scopy, that means they're looking inside with a scope. So this one didn't say anything about looking inside the lungs. We're measuring lung function. What's that handheld device that you tell a patient to inhale? It's an incentive spirometer. So that's right. It's going to be A, spirometry is what we use to measure lung function. And I know you've seen these devices and you have to remind your patients to use them every commercial break. Use them about 6 times per hour. Take deep breaths in. You inhale with an spirometer. You don't blow out. So the suffix metry refers to the process of measuring, and spiro refers to breathing, making spirometry the correct term for measuring lung function. A bronchoscopy is when they're actually looking inside down to the bronchioles with a small tube that has a camera on the end. What does the term laparotomy mean? Is it A, surgical removal of the abdomen, B, incision into the abdomen, C, surgical repair of the abdomen, or stomach, D, inflammation of the stomach? And anytime you see lap in front of a word, that usually means that this person has had a surgery with small incisions, laparoscopic excisions. So the answer is going to be B. So that's like the best way to have a surgery. You want the smallest incision possible. And so the suffix tomi means cutting in two, and laparo means or refers to the abdomen. And so what they do is they make a small puncture and then they inflate the abdominal cavity or the wall, and that's how they're able to look in and visualize, and they don't have to do that whole midline incision like they had to do back in the day where they really cut a patient open in order to do an abdominal surgery. So now most of the surgeries are laparoscopic. A patient with scleroderma has which of the following? Is it A, soft skin, B, inflamed skin, C, dry skin, or D, hardened skin? So scleroderma. When someone has sclerosis, was that softening or hardening? And then you add derma to it. So take that suffix, that prefix and suffix and put it together. And which do you have? That's right, you should have D. So that person who has that really dry, that alligator crocodile type skin, that would be scleroderma. Which of the following terms refers to excessive fear or pain? Is it algophobia, painphoria, hyperalgesia, or anesthesia. This one's hard because B is not a word. B is just something I made up. Tyson is just typing in stuff. Tyson, go to sleep. All right, everybody. The answer is going to be A, is algophobia. And so algo refers to pain like algia, and then phobia means fear. All right, I put you in timeout, Tyson, because I have no idea what you got going on. A patient undergoing a thoracentesis is having, is it A, a lung removed, B, fluid withdrawn from the chest, C, a breathing test, or D, a heart bypass surgery? All right, so we have A. Do we have any other answers? A patient undergoing a thoracentesis. So centesis is not removal. All right, so we're torn between, oh wow, we have D's, A's, and B's. And so a thoracentesis is when, yes, it's going to be B. Fluid is withdrawn from the chest. And so we will, when I say we, it's going to be a surgeon or a pulmonologist. It's going to be somebody who specializes in the study of the lungs. They can remove that excess fluid with either a needle or they can use a collection bag. And worst case scenario, the patient may have to have a chest tube, but that is how we can remove fluid from the chest area. And guess what, team? You did it. I am so proud of you because I know this was a long video and I am proud of you for studying with us. Remember that whether you're a future CNA, a future medical assistant, phlebotomist, whatever your desire is, you learn these medical terminology. It's going to be huge because it's going to make you a better caregiver. And when you understand the conditions and you understand those prefixes and suffixes, you're going to be a better caregiver. So regardless of whatever you decide to do, wherever you are now and you're studying, it's going to make you so much better in the future. So I appreciate you. I'm going to be looking in the chat soon to see what other questions you have. And for those who are our channel members, don't forget that whenever you go to the community post, you can download. I think last month we uploaded 3 different practice tests and we gave you a link so you can get more practice tests. But now you can download the slides for this one. They're already posted in the community area. And we want to thank you all for supporting our channel. Every little bit helps. And Fernand, who was here earlier, want to thank you again for the super chat. And for those who want to do more than CNA, we do have our online medical assistant training program where you're going to learn phlebotomy, EKG, and of course, the skills needed to be a medical assistant all in one. You can go to our website. Let me hide myself. You can go to our website, which is floridacareeracademy.com, and just scroll down and you're going to see information on our online medical assistant training program. You do have to be in the United States. So this is not something you can take abroad. You have to be in the United States because we are going to partner you at a clinical facility in your area. So yes, it's hybrid. You're going to complete most of your studies online, but when it's time for you to go into a lab, to a doctor's office, you have to be within the state so we can send you somewhere so you can get those hands-on skills and that hands-on practice. And that's it, everybody. Thank you all for watching. I'm going to hang around and stay around just to read the comments to see what questions you all have. So I'll be here for about 3 minutes. Oh, you're so welcome, everybody. Hey, Q Smitty. I met you through Brit Brat. Keep up the great work. Thank you so much. All right, this is a great time to pick my brain. What questions do you all have for me? Let's see here. Let's see what questions you have. I'm going to show them on screen. You're so welcome. Let's see, I'm in Jamaica and want to study. How can I connect? And so, right now, we have so many issues with traveling. And so, I think the best way for us to do this is for you to find a training center in Jamaica, but you can definitely use our videos. You can purchase our book. Our book is available on Amazon, and that will be how you can, still study, but it's hard for you to travel right now, and come to US with everything that's going on, and we don't want you to get here and not have your work visa. So you work on all of that, and that way, whenever you come to the US, you would be able to stay here. All right, let's see what other questions we have. No, we don't, Q Smitty, but if that's something that you want to work together and focus on, because most of me and my friends, we're all busy professionals, and sometimes what we forget to do, believe it or not, is eat. So most of us are just eating one meal a day. So if you have any recommendations and you want to do a collab, I'm going to put my email address in the chat. And let's talk about how healthcare providers can have, you know, some better, healthier eating options. Tyson, I thought I put you in timeout. Tyson, back in timeout you go. There we go. Tyson's back in timeout. So Joyce, the CMA program is based upon you. So the CMA program is self-paced. So however long it takes for you to complete your studies, so it could take 4 months. It's self-paced. So I know, and it's going to sound crazy, when I was finishing my master's in nursing, that program for some people it takes 2 years. For me, only took 10 months because I had the time to get those courses done. And so you don't want to rush through it. So if it takes you 6 months, beautiful, but that's a self-paced program. So you're going to work at your own pace. Okay. And so whenever you go to the website, floridacareeracademy.com, which I'll put in the chat, you can speak to one of our career advisors and ask them, what time frame, based upon what your needs are, do you think would be best for you to complete that program? All right, next question. I'm doing an online phlebotomy class. However, it's very hard to find a site to do my clinicals. How do I go about that? I don't recommend you do an online phlebotomy program. That's number one. And so yeah, I'm sorry, I don't have an answer for you, because some people will offer you things that don't make sense as a clinician. And so if they are only offering the online program, but they're not offering you any live sticks, they shouldn't be offering that program. And so what we do here at Florida Training Academy is we have a 2-day phlebotomy course for those who are already in the medical field, such as CNAs, MAs, nurses. Our nurses usually don't know how to draw blood. They don't teach you how to draw blood in nursing school. So you have to learn on the real patient in real time. And so we're a safe place for them to learn. Our CNAs who are working in the hospital called patient care techs, some of them are able to draw blood. So we don't let people off the street come into our phlebotomy course because we know they won't be employable. And so sounds like this person was just, hey, take my online phlebotomy course, and we're not responsible for you getting your sticks. So it's going to be hard for you to get those sticks because no one really trusts you right now. So I would recommend that either you ask for your money back and maybe go to the community college, or get your CNA license or certification and then work in the hospital and tell that hospital system that you have taken a phlebotomy course, and hopefully they will allow you to start drawing blood on the patients so you can get your other sticks. But without any certification, I don't have a good answer for you. So sorry about that. All right, so Melissa says, I'm nervous. Tomorrow is my skills test in Springfield, Massachusetts. Thank you for all your videos. Well, look here, Melissa, I've been there. We've all been nervous. You're going to do fine. I need you to get some rest. I don't know what time it is in Massachusetts. I'm thinking we're on the East Coast, so it's probably about 10 o'clock. So you've studied enough. You're going to get rest. Make sure you already have your uniform out. If you're not going to eat breakfast because of your nerves, have you some bananas, some water. Just take some fruits with you so when you get to that test site, have your uniform out, your IDs ease out, arrive early. If you don't know what the test site is, make sure you beat traffic, and you're going to do fine. And it's okay to be nervous. We've all been there. We've been nervous, but you're going to overcome this. In Florida, if we mess up, we can say correction. So hopefully in Massachusetts, if you mess up, you can just let the nurse know that you messed up and just acknowledge that mistake and keep going forth. And we look forward to hearing from you tomorrow with great results, because you're going to pass your tests. All right. Let's see who else. Elitha says, thank you. You're so welcome. And so if you all don't have any other questions, look, I'm starting to get sleepy. So if you don't have any other questions, I'm going to be signing out. So you're so welcome, Melissa. So good night, everybody. Thank you for hanging with us. And I love you. And for all my testers, I'm going to be praying for you. And good luck, and keep us posted. Bye, everybody.